Doc Jeff? Ay, Sir Jeff? Pwede pa co-host po si Dr. Janice. Thank you po. Tsaka po si Dr. Alina.
Buksan ko ba yung speaker doon?
Good afternoon, everybody. We'll start in a minute. Good afternoon, our dear parents and guardians. I am Mrs. Esteves, your Assistant Headmaster for Student Affairs, and I will be your MC for this afternoon. Without further ado, I would like us to go straight to the prayer to be led by our nurses.
What are you doing?
Good job, Atenista. This is our battle cry as we open this AGS vaccination drive. And as we ensure that our students, your sons, get vaccinated and be able to provide and we can be able to provide an alternative location for this purpose. It started with an announcement that was accidentally passed on to everyone, and our LGU picked it up and also gave us the chance to have this vaccination drive in our location. The office initially thought that we will just be distributing virtual IDs to everybody for you to be able to avail the vaccination in your own LGUs. But due to insistent requests from parents, we are here now. We are gladly having all these preparations for our vaccination drive. The school is also glad to be serving you and your sons through this vaccination drive. And we thank you, our dear parents, for participating actively in the preparation of this vaccination drive. From Atenista Res Vacuna to Atenista Vacunado Ka to Res Blocuna to Atenista Res Blocuna to now, our title for this event, our official title is Good Job, Atenista. I would like to welcome you to this afternoon's gathering. And again, good job, parents and guardians, because this simply shows that you would really want your son to be vaccinated here in our school, a very safe place. Good job to your sons this Saturday and the next 2 schedules. So without further ado, let's get right on with the program. To introduce our speakers for this afternoon, we'd like to welcome Dr. Pelayo, one of our school physicians.
Good afternoon, everybody. For today's event, we are grateful that we have invited 2 speakers to give us an orientation for the vaccination drive that will be held on the 19th, 26th, and 28th of February for Ateneo grade school students ages 5 to 11 years old. Our first lecture will be given by a representative from the Department of Health, Head of Metro Manila Center for Health and Development, Dr. Janice Rojas Malicido, and her lecture will soon be followed by Ms. Nerissa Peñaflor, a representative from QCLGU Health Education and Promotion. Everyone, let us first welcome Dr. Janice Rojas Malicido.
Thank you, Dr. Pelayo. Good afternoon, everyone. Good afternoon, parents. First of all, we would like to thank everybody, especially the Ateneo team, for hosting this advocacy and the orientation to our dear parents, no, in terms of the implementation of our 5 to 11 years old COVID-19 vaccination. We are very grateful, no, for the opportunity of having us with you so that we can impart, no, the first few runs of our implementation for our 5 to 11 years old, and hopefully this will help us, no, advocate to other parents as well that we need to vaccinate our 5 to 11 years old children in preparation, no, in preparation for our face-to-face classes, and also for them to safely go out and safely kahit sa bahay, but when we as parents go out, they are at least, no, safe when we bring with us the virus if ever. So this is a very good avenue for us to share our implementation runs, no, in the past a few days for our 5 to 11 years old. As we have seen, no, in the media that we launched several sites for our 5 to 11 years old in Metro Manila. So with that, I will share po my slides on this pediatric population age groups. I would also like to have to introduce to everybody my team around with me, no, Dr. Ara Hurao, Sir Arnold Alina, and our communications team representative, Ms. Lynn Legarhet-Teja. So yon, I am Dr. Janice Malicido, no, which will be orienting each and every one of us on this vaccination. Next slide, please. Yan. So just to reiterate, no, although you have seen this already on medias, no, that our FDA, no, our Food and Drug Authority, already gave emergency use authorization for our Comirnaty or our COVID-19 mRNA vaccine for 5 to 11 years old, which was as early as December of 2021. Next slide. Then come January, we were already able to come up with the guidelines, on the interim guidelines on the administration of this tozinameran COVID-19 mRNA vaccine, which is Pfizer produced, no, which we call it Comirnaty, no, parang adult din Comirnaty, but this one is tozinameran COVID-19 mRNA vaccine, no. It's a Pfizer COVID-19 vaccine specifically made for a population of 5 to 11 years old. Next slide. So with that, no, sa ating implementation interim guidelines, we are allowed, no, to implement on vaccination sites the vaccination of this 5 to 11 years old. But it comes along, no, that this vaccination site shall be designated only for 5 to 11 years old. So I am happy that Ateneo community offered, no, with in coordination with the local government unit of Quezon City, the site, no, which is a very much safe site for our children to be inoculated with this vaccine. So ito lang po is para may idea tayo how does a Pfizer Comirnaty for 5 to 11-year-old look like. It comes with the orange cap, no? It is a multi-dose vial as well. Meaning to say, in one vial, 10 bata, 10 kids can be inoculated, and we are giving them only 0.2 ml, 0.2 no, ml per child first dose, and then after 21 days, another 0.2 ml for the second dose to complete the primary series for the 5 to 11 years old. No, just an information as well. On your right, you can see the box. No, it comes in cartons, and it comes in 10 vials per carton. So yan yung makikita ninyo on site if as parents, no, gusto natin talaga makita what will be inoculated to our child, just to make sure, no. But do not worry, because the vaccination sites for our 5 to 11 is purely designated for 5 to 11 years old only. Kaya so that we will not confuse it, no, with other vaccines for COVID-19. Kaya purely designated for our 5 to 11 years old. Next slide. So this is lang to share, no, our based on the clinical trials of our Pfizer BioNTech, no, COVID-19. Ito yung the most common side effects, or what we call the immunologic reaction for our 5 to 11 COVID-19 vaccine. So most commonly is headache, no? Very common is the headache. Yung the rest are not much common, and later on I will share to you yung experience naman ng ating National Capital Region. How did we look at the side effects, no? Next slide. So apart from headache, ang pinaka-isang common is yung the injection site pain, no? In any other routine vaccinations ng kids natin, meron talaga yon. There is always the site injection pain, and then with this vaccine, there is a finding of common yung diarrhea, no? And then muscle pain, and then what else? Yung mga ano natin, yung chills, no? Slight or low-grade fever. And then yung injection site pain. So those are mild reactions that are reported based on the Pfizer BioNTech vaccine clinical trials. Next slide. And then this is just to share, no, as of to date, no, since we started our 5 to 11 years old vaccination February 7, or roughly a few days pa lang, a week na tayo nag-implement, close to 9 days, no, of implementation. We were able to vaccinate a total of 125,762 5 to 11 years old. This composed of both the ones with the comorbids na 5 to 11 years old, and the rest, no, of the 5 to 11 years old. So with that, no, we are so grateful for the help, no, ng intersectoral help sa atin. This is really the what we call the whole of the society approach, where nagtutulungan talaga po all the sectors, the private and the public sectors in this vaccination. But with a total 125,762, ito lamang po yung reported natin na AEFI symptoms. No, you have rashes. This is for Metro Manila. This data came from our Regional Epidemiology and Surveillance Unit. So we only have rashes, dizziness, fever, vomiting, and sore throat. And with that, it is about 0.02%, no, out of the total vaccinated. So kung titingnan natin, it's very unlikely, no, they have unlikely to develop the what we call the immunologic reactions due to the COVID-19 mRNA vaccine. Next slide. These are just my final key messages no sa ating lahat that children no can get COVID-19 and can also infect others if they are positive. Kaya kailangan talaga natin silang protektahan. And then vaccination works. Vaccine protects them from getting severe disease, and of course we do not want mortality from COVID-19 no, as we are facing now yung pag-lift ng ating alert levels no, we hope to also look at the coverage of our kids no, of our 5 to 11 years old, natataas yung kanilang coverage for this vaccine kasi para lahat protektado no, even if we open all our anong tawag mo nito, yung open our commercial establishments so that they can also enjoy no yung kanilang social interaction no during the face to face no, kaya we really need to have them vaccinated. And then third is that it gives the children an added protection no pag nag-resume na ng klase. So kailangan natin, because we cannot say no that when we are vaccinated we cannot anymore be infected. No. Vaccine prevents us from getting severe infection no, but we can. We have the if we are at risk lalo na sa work natin no, we can always we can have it no, we can be infected, but at least we can prevent no from being severe and also help us also lighten the burden of our health system as well. So yun. And as the benefits of such protection, syempre, from severe and long COVID complications, as we all know, no, COVID complications, especially those with pneumonia no, and other complications from COVID, is ang iba is long, no, yung long ang duration, kaya we can prevent them by vaccinating them so as to give them protection ahead, no. And then all children must complete routine immunization to be protected from other communicable diseases. Yung routine immunization natin is still very critical no, because apart from being protected from COVID with the COVID-19 vaccination, we still are to protect them from other vaccine preventable diseases no. Ito yung mga routine immunizations ng ating mga anak no, and the booster doses of those routine immunization. Next slide. Would like lang to share no to everybody the launching of our 5 to 11 in the different no LGUs of Metro Manila, but this is particularly in the city of in your location no ng ating Ateneo, which is Quezon City. So as we see it very festive, and the areas and the sites are made para hindi matakot yung mga bata for the thought na lang kasi na injectionan sila. So a bit of fear talaga po no is there when it comes to injection. Next slide. And then we would like also to encourage yung postings natin no, if we want to if we want lang naman to share no yung ating experiences for our vaccination, especially our kids, para maengganyo din po yung ibang bata no na mabakunahan din sila, because once nakita ng iba na tapos na tayo, and then the rest no will also be encouraged to be vaccinated. Next slide. How can I prepare my child for the vaccination? Una, syempre paintindi lang natin, no, let us listen and understand to their emotion when we say tomorrow or the next week is your schedule for the vaccination. And then just to give some details no, on how it will go through, and why they are supposed to receive the vaccine, and what are the possible feelings or the symptoms that they can have or might feel after the injection. Next slide. And then explain to the child is a very important thing, no, na kailangan lang talaga it's for them to understand that what we are doing is for them to protect themselves against COVID-19 since we are still in the pandemic stage, no? And then yon explain ang detalye, no, because they had been into our routine immunization kaya alam nila yung anong itsura ng needle, how will it feel when it is poked sa kanilang left deltoid arm. Next slide. Next slide po. Yan. Again, how can I encourage my child, no, and others to get vaccinated? These are just, if you want po, no, these are just advocacy actions that we would like to encourage, no, that if you would like to share your experiences on COVID-19 vaccination, especially your kids, you can post it and hashtag lang po yung kwentong res bakuna natin para others would also be able to see that these kids are already vaccinated. Next slide. So yan kung paano ninyo sa i-upload, document lang your experiences, no, on how do you manage, no, to take note of the what they feel, what are their thoughts, and then hashtag Res Bakuna Kids and kwentong Res Bakuna. I think that would be all. Yes. Okay. Thank you and good afternoon. But before I will end this, we would like also to share our video, no, on the regarding our 5 to 11 vaccination and our advocacy for our 5 to 11-year-old COVID-19 vaccination. Can I have Miss Lynn Legarteja to share the video? Thank you. Ma'am, permission po to let Lynn Legarteja share her slide. Thank you.
Sige, ma'am. Lynn? Okay.
Magandang araw! Ako si Doc Benjo at nandito ako ngayon para magbigay ng impormasyon tungkol sa mga bakuna kontra COVID-19. Sa araw na ito ay naalok ka ng bakuna kontra COVID-19. Sa kasalukuyan, ang bakunang ito ay maaaring ibigay sa iyo dahil sa Emergency Use Authorization mula sa Philippine Food and Drug Administration. Itong bakuna ay binibigay ng libre galing sa gobyerno. Ikaw ang magdedesisyon kung magpapabakuna o hindi. Gayunpaman, aming inirerekomendang magpabakuna ang lahat ng eligible recipients para maprotektahan hindi lamang ang bawat individual, kung hindi pati na rin ang bawat kapamilya mula sa COVID-19. Bakit natin kailangan magpabakuna? Maraming patuloy na namamatay at naghihirap ng dahil sa COVID-19. Sa tulong ng bakuna, maaari nating maiwasan ang symptomatic infection at maiwasan ang ma-ospital o mag-agaw buhay ng dahil sa malubhang impeksyon. Ayon sa pinakahuling datos noong huling Enhanced Community Quarantine sa NCR, Karamihan ng mga pasyente sa ICU o 8 sa bawat 10 pasyente ay mula sa hanay ng hindi pa nababakunahan o hindi pa kumpleto ang dose ng bakuna. Sa madaling salita, protektado ka at ang iyong pamilya kapag lahat ay magpabakuna. Anong mga bakuna para sa COVID-19 ang gagamitin? Ligtas at epektibo ba ang mga bakunang ito? Ligtas at epektibo ang mga bakuna natin. Tanging ang mga bakunang nabigyan ng Emergency Use Authorization ng Philippine Food and Drug Administration ang ibibigay ng libre sa bawat Pilipino. Patunay ang EUA na masusing pinag-aralan ng mga iba't ibang grupo ng mga doktor, healthcare professionals at mga eksperto ang bakuna para siguraduhin na ito'y ligtas at epektibo. As of October 11, 2021, ang mga sumusunod na mga bakuna ang nabigyan na ng EUA sa Pilipinas: AstraZeneca, CoronaVac o Sinovac, Covaxin, Janssen, Gamaleya Sputnik V, Moderna, Pfizer at Sinopharm. Samantala, ang mga bakunang Moderna at Pfizer ang nabigyan ng EUA para sa pagbabakuna ng mga batang edad 12 hanggang 17. Paano binibigay ang bakuna sa COVID-19? Karamihan sa COVID-19 vaccines ay binibigay bilang injection o turok sa braso. Depende kung anong meron sa kasalukuyan, maaari kayong mabigyan ng bakunang 1 dose lamang o ng bakunang may 2 doses na may ilang linggo sa pagitan ng bawat turok. Para matanggap mo ang ganap na proteksyon ng bakuna, importanteng tandaan na kung ikaw ay nabigyan ng bakunang may 2 doses, dapat siguraduhin mong makumpleto ang 2nd dose ng kaparehong brand ng bakuna nang naaayon sa schedule. Ano ang mga maaaring maranasan pagkatapos mabakunahan? Iba-iba ang nagiging reaksyon ng bawat tao sa bakuna. May mga walang nararamdaman pagkatapos mabakunahan. May mga tao namang may minor reaction sa bakuna. Ang pinakakaraniwang naiulat na minor reactions ay sakit, pamumula o pamamaga sa lugar na tinurukan, pagkapagod, sakit ng ulo, sakit ng kalamnan, sakit sa kasukasuan, panginginig, lagnat, pagkahilo o pagduduwal, masamang pakiramdam, at pamamaga ng lymph nodes o kulane. Karaniwang nararanasan ang mga ganitong minor reactions sa unang 3 araw pagkatapos bakunahan at inaasahang mawawala rin ito ng kusa. Kung sakaling makaranas ng minor reaction, huwag mag-alala. Hudyat ito na bumubuo ang katawan mo ng proteksyon laban sa COVID-19. Sa kabilang banda, kung walang nararamdaman pagkatapos bakunahan, hindi rin naman ito nangangahulugang hindi gumagana ang bakuna. Kung may nararamdaman, i-report ang lahat ng reaction sa hotline o contact person na ibibigay ng inyong local vaccination site. Kung mas lumala ang pakiramdam pagkalipas ng 24 na oras o hindi pa rin ito nawawala pagkatapos ng 3 araw o may nararanasang di pangkaraniwan, sumangguni sa inyong doktor o sa pinakamalapit na clinic, health facility o center. Meron ding mababang tsansa na ang mga bakuna ay maging sanhi ng malubhang reactions. Karaniwang nagaganap ang mga ito ilang minuto hanggang 1 oras pagkatapos makatanggap ng kung makaranas ng hirap sa paghinga, malubhang sakit sa ulo, dibdib o sa tiyan, o panghihina, agad na sumangguni sa pinakamalapit na emergency room. Kung eligible kang mabakunahan, higit naming hinihikayat na ikaw ay magpabakuna. Kung mas maraming Pilipino ang mababakunahan, mas maraming buhay ang mapoprotektahan at mas mapapabagal ang pagkalat ng COVID-19. Ngunit, laging tatandaan na kahit nabakunahan na, kailangan pa rin sundin ang BIDA behaviors. Paghuhugas ng kamay o pagsasanitize ng mga kamay, pagsusuot ng face mask at face shield, pagdistansya sa ibang tao ng 1 metro, at siguraduhin na may maayos na daloy ng hangin. Ito ay para sa ating proteksyon at sa proteksyon din ng iba. O paano? Ingat po at kita-kita tayo sa BIDA Vaccination!
Thank you. At this point, we call on Nurse Neri from our QCLGU.
No, ma'am. Ika. Good afternoon, everyone. Do can you hear me, ma'am?
Yes, ma'am.
Okay, so I will start na the orientation on COVID-19. So welcome po. I'm Ms. Nerissa Peña-Flor from the QCLGU. I'm the Health Education and Promotion Officer of the Quezon City. So the title of my orientation is Vaccination on COVID-19 for 5 to 11 years old. Okay. So this slide shows COVID-19 vaccine of all types and at all age group continues to protect against severe disease and death. So it includes our Pfizer vaccine for 5 to 11 years old. So we can't reliably predict who will have mild or severe illness. So please allow your children to be vaccinated. So this shows that 85%, no, among 85% were unvaccinated and were hospitalized and admit or confined in a ICU and hooked with a ventilator. So unvaccinated here is the red dot, and the yellow dot is the partially vaccinated, and the blue one is the fully vaccinated. So as you can see that 85% among this all categories for having a COVID-19 disease were hospitalized and being lower, no, or higher risk to have COVID-19. COVID-19 vaccination in kids. So the benefits are protects against severe disease and death, even in children. Additional safeguard for gatherings, safe reopening of schools, and protection to those who cannot be vaccinated. So this one was already mentioned earlier, Dr. Janice, about the COVID-19 vaccine for 5 to 11 years old. So for adults, we have the Sinovac, AstraZeneca, Moderna, Novavax, Johnson & Johnson, and the Gamaleya. For the age 12 to 17, we have the mRNA-based or the Pfizer vaccine, Moderna. And for our children 5 to 11 years old, we have the Pfizer vaccine. So we focus only on the 5 to 11-year-old vaccine. So this one, to give you an idea or just good to know on this appearance of the vials of the Pfizer vaccine for 5 to 11 years of age, no? With an orange cap. Itong purple cap po, this one is for 12 to 17. So the one with an orange cap, yun po yung sa ating 5 to 11 years of age. So na-discuss na rin po ito ni Dr. Janice. And one vial is good for 10 doses po ito. So Pfizer, 5 to 11 years old, it is already discussed earlier that the product name for this Pfizer vaccine is Tocenamiran COVID-19 mRNA vaccine or Comirnaty. Ito po yung pinaka-brand name niya. And the dosage or form is 10 microgram per dose, concentrate for dispersion for injection. So the route of injection is intramuscular. So it is more on to our vaccinator, no, or inoculators. And one dose is equivalent to 0.2 ml contains 10 micrograms. And the packaging, multi-dose vial, it means that 10 doses, and it must be diluted before use. One vial of 1.3 ml contains 10 doses of 0.2 ml after dilution. So the 0.2 ml is the one, the dosage for children 5 to 11 years old. So I will not discuss the 12-year-old and above. So we will focus only on the 5 to 11 years old children. So the storage and handling and preparation, just good to know also, check the appropriate vial, orange cap, prepare the appropriate syringes and diluents. So the QCLG naman will give you the complete logistics, the syringes and the vaccine, and check the shelf life and storage for 6 months frozen at negative 90 degrees centigrade to negative 60 degrees centigrade. One stove can be stored at +2 or +2 to +8 degrees centigrade for 10 weeks within the 6-month shelf life. When we have our ocular in the Ateneo, we asked or request a domestic refrigerator should be ready before the vaccination activity, because once the Pfizer vaccine delivered, so you have already your refrigerator for the storage of the Pfizer vaccine. So the dose volume is 0.2 and the amount of diluent needed per vial is 1.3 ml. So I think that your vaccinator or inoculator had already an immersion in our vaccine, one of our vaccination site. I think Sky Dome at SM North. So they were already oriented about the vaccine, how to prepare, no, how to prepare the vaccine, Pfizer vaccine. So, ito po yung itsura niya, no? Ayan. Okay. Yan. So, ito po yung itsura ng ating Pfizer vaccine. An orange cup po, with an orange cup. So, naka-note po dito, do not freeze. Once to, yung vaccine, ilalagay lang po natin ito sa body of the ref. So for vaccination, on vaccination day, yung mga requirements, no, to be requirements needed, child is accompanied by parent or guardian, proof of relationship or proof of affiliation or filiation, valid ID of child with picture, valid ID of parent or guardian with picture also, medical certificate if with comorbidities, and also well-fitted or proper yung wearing of face mask, if can be meron pa ring face shield required in a medical setting, writing materials like ball pens, no, na kailangan, and then the alcohol, pan, water as necessary. So ito po yung dapat na requirements needed na dalhin ng ating vaccinees and the parent and guardian. So on the vaccination day, required documents, best evidence po is the original copy or birth certificate, but we allow Xerox copy for the documents, and the secondary IDs with parent plus child names, no? So under the secondary IDs, authenticated medical certificate of the child-bearing name of the parent issued by hospital or DOH, baptismal certificate of the child with the name of the parents, school ID or records of the child, example, transcript, form 137, bearing the name of the parent, PhilHealth, Social Security System or SSS, the government ID, the government service assurance system forms, insurance policies. We have also the barangay certification is issued by the barangay captain indicating that the parent and the child is personally known and attested by one other witness who personally knows the child and the parent And then for the solo parent identification card from the city or municipal social welfare and development office. If under court decree of adoption, in case the child is adopted, PWD of the child and other public document issued by the Office of the Civil Registrar General as applicable. These documents are very ideal, but the QCLGU also already allow Xerox copy for the guardian as long as there is authorization, authorization from the parent with the parent ID picture, Xerox copy. So tinatanggap na rin po yun. On vaccination day, still on vaccination day, requirements for guardian, kung wala yung parent, so special power of attorney, pero sabi ko nga, it can also be the authorization, only authorization letter from the parent. If not available, notarized authorization letter, written affidavit of parent or guardian under an oath public official such as the notary public. Example, barangay officials with presentation of a valid government ID. And then barangay certification, if there is no authorization letter, can be the barangay certification issued by the barangay captain. So, pwede na po yan. So for the medical certification, medical certificate is necessary for the following patients with comorbidities, with medical complexity, genetic condition, neurologic conditions, metabolic and endocrine diseases, cardiovascular diseases, obesity, HIV infection, but on obesity, weight is not an issue, but it depends upon or the discretion of the doctor. No, if he or she may want the child to weigh. HIV infection, tuberculosis, chronic respiratory diseases, renal disorders, hepatobiliary diseases, and the immunocompromised state due to disease or treatment. So these are the conditions that will need medical certificate. So for the consent and assent, for children 7 years old and above, we need the consent and assent. Consent of the parents and assent of the child. Below 7 years old, just consent only. Okay, so we have informed consent and we have two forms. We have informed consent and declaration forms. So vaccination sites, especially in phase 5, should monitor and highlight good practices in getting consent and assent, including action taken for dissent. So dapat po pakitingnan yung complete, no? Yung complete details. Paki-fill up, properly fill up po yung inyong informed consent and the health declaration. And then please take note po yung kanilang signature kung nakasign po talaga sila for the consent and assent. So these are the example of the informed consent and health declaration. And it will be checked already in the registration area. So if you remember in your adult vaccination activity, still the vaccination strategy is still the same. So we have the waiting area, we have the registration, we have the screening area, we have the vaccination and the post-vaccination area. So these two important forms, no, must observe. So there is an important note, wait kids for meds in AEFI if necessary. Recovering with mild symptom can be vaccinated. So kaya lang po kinukuha yung timbang because of if there is an adverse event following immunization, kung magbibigay po ng medicine. So mami-measure po yung dosage. Kung ilan, no? Kung ilan ang dosage na ipapainom. So this one I will not discuss on details kasi for vaccinator po ito. This is how they prepare the Pfizer vaccine. So for the post-monitoring, after vaccination, the vaccine recipient shall stay for post-vaccination monitoring in case of any severe allergic reaction and anaphylaxis for immediate treatment. So it was already discussed by Dr. Janice. And for 15 minutes, if without any known allergies or history of anaphylaxis. For 30 minutes, if with known allergies or history of anaphylaxis. So advice for fever, dose-based paracetamol or sabi ko nga, be ready with your emergency kit, no, with epinephrine and tuberculin. And then your paracetamol, your antihistamine, and then must be on a standby ambulance in your site during your activity, your vaccination activity. Okay. So you can see the AEFI management pathway for pediatric population on this link po. So what are the side effects? So the side effects, most common, local reaction, pain on the injection site. Pwede rin silang makaramdam ng systemic reaction like muscle aches, fatigue, headache, no, fever. Okay. So kung if fever persists, give paracetamol. So still on post-vaccination advice. For post-vaccination team should calculate appropriate dose based on weight. So may mga doctors naman po tayong naka-assign. And then instruct parent that if kid has temperature of more than 37.8 degrees centigrade, take paracetamol. And if fever persists after 2 doses, consult pediatrician. Pero after 1 dose, nawawala na naman po agad ang fever. So ano na lang po, observe na lang po and monitor. So this one, post-vaccination advice po ito regarding our routine or the national immunization program. Kasi aside from the COVID-19 vaccine, we still have our measles, rubella vaccine, the tetanus diphtheria vaccine. No, this vaccine was given during special activities, no, the MRTD vaccination. So I think that is my last slides na po. So thank you very much for listening.
Thank you very much, Dr. Janice and Nurse Neri. At this
Yes.
point, we're now going to be opening the floor for questions. But before I allow you to unmute, I will have to prioritize those who have typed in their questions in the chat box. At the same time, those who have typed in their questions in our live chat in our YouTube channel. So we'll start with this very important question. My child has convulsions when his fever gets high. Is it okay if he gets vaccinated? Does he need a medical certificate? We'd like to ask any of our speakers, Dr. Janice probably.
Yes po, good afternoon. Ulit, yes, for the question kung may fever at the time po of vaccination, meron tayo pong mga panuntunan, no? Like what we are doing with the other vaccines, the child has to be assessed, no? Prior to be vaccinated. Una, may mga physicians that will assess, so most likely, no, upon assessment by the physicians natin, if indeed that child for that day is not eligible or is eligible for vaccination, sila po yung magsasabi na, ma'am, balik na lang po kayo when the child is well already, or upon assessment, okay lang naman, hindi naman serious illness that is contraindicated for the vaccination, then they will also say so, no? Kaya tayo may mga screening physicians to be able to look at the eligibility of the child on that day of the vaccination. Thank you.
Thank you, Doctora. At this point, I would like to request our technical team to please pin in all our doctors who are supposed to be panelists this afternoon. Dr. Shaw would like to welcome our university physician. Dr. Norman Dennis Marquez is with us this afternoon. Also, our doctors from our health services office, we have Dr. Martin, we have Doctora Pelayo, and Doctora Pau
Good
Santos
afternoon,
Estrella.
everyone.
Afternoon.
Afternoon po.
So, anybody can answer. Will there be vaccinations for 5 to 11 years old after February 28? Our pedia is still hesitant giving the go signal for my son to get the vaccine, as he said he is still waiting for further studies. Can anybody respond to this question?
Wala. Ma'am, Dr. Martin po.
Yes, Dr. Martin.
Wala pa po tayong schedule after the 28, no? So most probably,
Hindi.
nasa second dose pa lang po tayo nung dun sa first by that time po. So we'll update po yung ating community regarding that period. Thank you.
Thank you, Doc.
Hello, ma'am.
Yes.
Hello, good afternoon. This is Bermas, Kinder Kunig, and 2 Acacia. Ang tanong po, is the vaccination will be done drive-through or bababa po sa campus?
Okay. Yes.
Bababa po, ma'am. Ma'am, Dr.
Okay.
Martin po.
And
Bababa po
another-
sila sa atin sa heritage room po.
Heritage.
Kasi very
Thank you, sir.
sensitive po ang
Another
ang-
question,
ang
sir,
vaccine.
for ma'am and
Opo.
sir. Since I have 2 Acacia and Kinder Kunig, pwede po bang pagsabayin na lang sa Saturday 26? Kasi working po.
Yes, ma'am, you can always write the Assistant Headmaster for Student Affairs. Email is, we'll just type in the Assistant Headmaster for Student Affairs email, our office email. You can just direct your request to our office. Thank you, ma'am.
Okay, thank you po.
Okay. So we'll also would like to entertain the questions in the chat box. First, is there a difference in the vaccine formulation dose or dosage for the 5 to 11 years old and the 12 to 18 years old? What if my child is currently 11 years old, turning 12 this May, but is bigger than his 12-year-old sibling? I think there are also questions about weight and age as well.
Yes, ma'am. May I po answer the
Yes, ma'am.
question? Salamat sa question po. Yes, our COVID-19 vaccine for our 5 to 11 po is yung strength niya is lesser than our COVID-19 mRNA vaccine for our 12 to 17 years old. Tama po yun. The dose is as well different from the preparation. The strength is different. 10 microgram lang po ito. Yung isang vial ng ating 5 to 11 years old, tapos yung ating 12 to 17 is a 30 micrograms. So the dosage for our 5 to 11 is 0.2, and then for our 12 to 17 is 0.3. So age specific po ito. Kung ang bata ay 11 years old, then we will give the vial for the 5 to 11 specific for the age. Then if the child turns 12 years old po, then we will give the vaccine 12 to 17 years old. Kaya po age specific itong ating COVID-19 vaccine. Thank you.
Thank you. Another question related to the effects of the vaccine. Serious side effects like myocarditis is really alarming. Is it curable or reversible? And also the case of psychosis, is this one of the adverse effects too? Doc Norman, you want to take this? I think you're muted, Doc Shaw. Anybody can just chime in. Okay, yes. Yes, Doc Ted? You're also muted, Doc Ted.
Hello. Hello.
Yes, you're in already.
Narinig niyo po ako, ma'am? Narinig po
Yes,
ako.
Doc Ted.
Yes, ma'am. Regarding the myocarditis po, talagang evidence-based po, nagkakaroon yung iba, no? Pero yung percentage po nung nagkaroon after the vaccination is napaka-small po, no? Very small yung based dun sa census na present ng Israel, ng UK at saka sa US. Dito rin po sa atin, meron din pong nagkaroon, pero mostly naman po are na-manage ng maayos, ano? Hindi naman na-hospital ang patient at sila naman po ay naka-recover, no? Wala naman pong death, no, na nangyari after the vaccination at pagdating po sa mga cases na nag-myocarditis. Very low po ang cases.
And
Thank
if
you.
I may add,
Supportive lang
ma'am,
po karamihan.
Thank you. Yes,
if-
Dr. Arlene?
Opo. And also it was reported regarding the myocarditis. Sometimes the data shows kasi po, since this is a very new vaccine, the correlation between the vaccine and the myocarditis is not that ano pa po, na proven kasi it may be caused by other viruses. So hindi pa rin po sure whether it's connected with the vaccination.
Thank you for that. Another question about side effects. My son has tremendous side effects when vaccinated with MMR. Is it safe for him to have his vaccine? Do we have to seek medical certificate for this? He has COVID. He had COVID last August 2021. Anybody can just answer. Dr. Janice, you want to take this question?
Ma'am, our COVID-19 vaccine for our 5 to 11 is novel and mRNA yung platform niya. So it's a different platform from our MMR or our MR vaccine. Hence, kung allergy siya with MMR does not mean to say that when you will be given an mRNA platform, pwede ka ding mag-allergy or vice versa. But then again, during the assessment, prior to vaccination of COVID-19 vaccine, we will label them as a high risk, no, or moderate risk, depending ngayon sa assessment on how severe is the allergy of the child. Kasi po pwede kasing they will also develop allergies with mRNA. Kaya for high risk or moderate risk children, we are to observe post-vaccination at least 30 minutes. For those with low risk or walang risk, 15 minutes after the jab, and then they can go po. Thank you.
Thank you, Doctora. Would like to ask another question related on side effects. In case my son has dextrocardia, heart is pointed towards the right side of the chest, do we need to bring a medical certificate for this?
Yes, ma'am. They have to bring the med cert from their pediatric cardiologist po. Because this is a congenital heart disease po.
Thank you for that. This time, we would like to answer questions about related to what we will be presenting during the operations that we will have during the vaccination. We understand that this is exclusive to Ateneans, but I would still want to ask, just in case, can I bring my niece? We would like to apologize, but this is really exclusive for Ateneo students. Actually, our master list would have to be submitted, and the master list that we have to submit to our partner QCLGU would have to be our currently enrolled students. That's why, as much as we would want everybody to be taken in, we have to, of course, consider the advice of our partner in the QCLGU. As to the rescheduling of the vaccination of my son, we have answered that already. Again, you may write the office at assa.gs@ateneo.edu. Okay, as to the medical certificate says for those with comorbidities, do we still need to secure one if our son has no comorbidity?
No, ma'am.
Yes.
Apo. Kung wala naman pong comorbidity, no need na po.
Okay.
No need na po.
Thank you. Doc Shaw, you can still be Are you still muted, Doc Shaw? Okay. May I request the host to unmute Dr. Shaw? I can't unmute him on my end. Will Ateneo be requiring vaccination next school year? I think this is also related to another question about face-to-face classes. Would we be requiring our students to be vaccinated? I would have loved Doc Norman to answer this. Sir Jeff, may we please request Doc Shaw to
Hello?
be muted?
Okay, hello?
I mean to be unmuted. Yes, Doc Shaw, we can hear you now.
Yeah, sige. As a matter of precautions and of course good public health practice, we would like to maintain, no, the an environment where it would be safer for everyone, no? Those who are both studying and working on campus. So the vaccination policy is consistent with global experts' opinion, which are backed up by in fact increasing even more data now, no? As mentioned a while ago by the speakers, the safety profile have been validated by the studies. Even though we will have to admit, no, ongoing pa rin, no, the studies are still ongoing to make sure that the findings are even strengthened. We all know that there are more benefits than harm, no? So the benefits outweigh the harm that may be or that may develop in this in the process, no? If the question really is, yes, we will continue to ask people to, particularly, no, the ages 5 to 11 group, for as long as our data and evidence support the value of such an activity.
Thank you, Dr. Norman. So as for the grade school, we're still, of course, we have been discussing about the mode that we will be having. And of course, you receive surveys from us. So as of the moment, we cannot give definitive answers yet. We will, of course, be communicating with you as to the answer to this question, if we will be requiring vaccination. But as shared by Dr. Shaw, the president has announced also that those who will be reporting for work would have to be vaccinated. As to the children, we still have not discussed and finalized yet. There's another question here. Is it possible to have the second dose in Ateneo? Of course, there will be a second dose. For those who will be vaccinated at Ateneo, there will be second dose after 21 days. Am I correct, Doc Janice? Yes.
Yes, ma'am. For our 5 to 11, we will give 2 doses po.
Yes.
The first dose will be their 0.2 ml, and then after 3 weeks or 21 days, they will be back for the second dose, which is again 0.2 ml to complete po their primary series. Thank you.
Thank you. Yes, Doc Ted, you want to add?
Ma'am, baka po yung tanong niya is it possible for the second dose to be given in Ateneo? Yung first dose niya baka po sa ibang facility.
Yes.
Baka yun po yung tanong niya eh. So we will not allow
yes,
po.
Doc. There's actually another question
Yes, opo.
related to that. So,
So we
Doc, you want to
will only
explain?
entertain po yung sa atin. Kung binigay sa atin yung first dose, second dose po sa atin, we will not entertain po yung sa ibang facility binigay yung first dose. So sa atin lang po, yun lang pong first at second po. Exclusive po for the Ateneo boys.
Okay. I'm not sure if our headmaster is here. There's another question here. What is the purpose of vaccinating if vaccination will not be required for enrollment? Is Sir Jervy present? Can we ask him to respond to? I think this is an administrative question.
Hello. Good
Ayan.
afternoon. Good afternoon.
Yes, sir, we can hear you.
Yeah.
Thank you.
We are providing a venue for parents that they can actually avail of the venue for this vaccination. And since the issue about regulations on vaccinations is a moving target ever since, and therefore we would like to, as much as possible, maximize the opportunity for our students. Therefore, in the eventuality that it will be mandated that vaccination will be a must for anyone who wishes to go on face-to-face, then at least our students are ready. So since it's still a moving target, no, and we are still waiting for firmer decisions coming from the government. Therefore, we are just not taking any chances or just leaving anything to chance. We are trying to make it possible that our students, by the time we reach a decision as mandated by the government, we are ready. We are ready.
Thank you, Sir Jervy, for that very clear explanation. There's another question here. In case of an untoward side effect, will Ateneo have ambulance on standby to ferry patients to the nearby hospitals? Yes, we have. Actually, we have an in-house ambulance. It's the ARMU. It's been here every day, not just for the Res Bakuna drive, but also for on a daily basis. They are with us. But we're still not sure if our QCLGU partner would also provide an ambulance. But just in case there is, we have a ready ambulance for use. Thank you. Okay. So it's already 5:14. We're supposed to end at 5 o'clock. So as for the other questions, we would take them in. And since your names are here already, and we can just, and the grades and section of your son is present in the chat box, we'll just communicate with you directly via email within the week. So at this point, we'd like to thank our speaker and share with you the certificate of appreciation that we have. So I'd just like to read what's on the certificate. Ateneo de Manila University Grade School Department presents the certificate of appreciation to Dr. Janice Rojas Melicido for her generosity in sharing her time and expertise during the orientation for pediatric vaccination for parents and guardians of the AGS, given this day, 16th of February 2022, signed by yours truly and our headmaster, and to our other speaker, Ma'am Nerissa Peñaflor, would like to also award the certificate appreciation to Nerissa Vive Peñaflor for her generosity in sharing her time and expertise during the orientation for pediatric vaccination for parents and guardians of the AGS. Given the 16th day of February 2022, signed your truly and also our headmaster. So, thank you so much. Would like to end this by thanking everyone who has been with us all throughout the preparation. And of course, to our dear parents, would like to especially thank you for joining us this afternoon. This is a solid way of showing us that we are indeed partners in making sure that your sons, our students, are in the best of health, and of course, their welfare is our priority. So good afternoon, good job. Atenista will be launched this Saturday at 8 a.m. And thank you once again. Good job to all of you, our dear parents and guardians. Good afternoon and have a pleasant day ahead.
Thank you po.
Thank you po.